Good evening. It's Dr. Van Dorp here, and I'm going to present 10 cases of ASD and in childhood, pediatric ASD, Autistic Spectrum Disorder, and a couple of other neurodevelopmental disorders. And so I'll go ahead and share screen now and start the slideshow, and I'll just sort of dip us down here so you can still see me even though I'm up in the right hand corner. Okay, so to make this work and fit inside 45 minutes, I'm going to have to fly through everything. I've tried to make a couple of takes, couldn't get it under an hour, so third time lucky. Here we go. Right. So let's start with the definition of autism from Australian Institute of Health and Welfare 2017. Basically, the symptoms include difficulty in social interaction, restricted or repetitive patterns of behavior, and impaired communication skills. And these sometimes may not be recognized until later when they get under stress and go to school, etc. So this is the prevalence in Australia in 2015. They reckon about 1 in 150 people at that point in 2015. And you can see there on the graph the rates rising from 29 to 2012 to 2015. This is probably more useful as a slide for looking at the numbers. And so we see over here on the left, CDC statistics in 2023 show 1 in 36 children in the USA have autism. And that's about 4 in 10 boys and 1 in 10 girls. Boys are nearly 4 times more likely to be diagnosed. No known causal factor, but lots of debates about lots of different things. It's a very complex neurodevelopmental disorder associated with many other mental health diagnoses, including ADHD, OCD, epilepsy. 20% of autistic kids have epilepsy and 20% of epileptic kids have autism. Down syndrome is very similar, except that's involved with intellectual disability and speech and language delays by itself. Asperger's syndrome. Everybody knows the Asperger's guy that offends everybody without actually really realizing it because of his communication skills. And but that's now redefined as ASD level 1. Then you have Tourette's syndrome, tic disorders, anxiety, aggressive tantrums, destructive behavior, insomnia, sleep disorder, appetite disorder, many of these things in these kids. So it's basically split into 3 levels. ASD level 1 requiring support. It's the mildest or highest functioning, may have difficulty understanding social cues, may struggle to form and maintain personal relationships, but speaks in complete sentences, but have difficulty engaging in back and forth conversation. Some inflexibility of behavior, but can be hard to distinguish from a normal kid. Level 2, substantial support. Social communication and repetitive behaviors present themselves more obviously, and big challenges in verbal, non-verbal communication, as well as reduced or abnormal responses to social cues. Inflexibility of behavior is also more pronounced, and they have difficulty coping with changes in routine, which can cause very challenging behavior that looks like aggression and etc. Then ASD level 3, the top level, very substantial support. And that's characterized by severe challenges in social communication, as well as extremely inflexible behavior. Children in level 3 autism will be non-verbal or have just 1 or 2 words of intelligible speech. That's it. Marked inflexibility of behavior with extreme difficulty coping with changes to routine. So ASD, the plant med way, approved by TGA. 6 years of experience by Dr. John and Chloe at the Plant Med Clinic and their team have come up with some findings. Full spectrum extract of the CBD works better than the isolate, and so it needs the entourage effect. All the other cannabinoids, they make it work a lot better with these kids. Focusing on treatment of anxiety often improves all the other coincidental symptoms. A lot of it is anxiety that expresses in all these other things. Team effort is very, very important to follow up with care coordinators, etc., especially with these autistic kids, because they're quite difficult to handle. Children with aggressive tantrums or sleep disorder sometimes require increased dose of THC. And then since there's been a recent clampdown on use of THC in under 18s, it's a little bit difficult for us to handle some of these things. That came in about April, May this year. So the types of CBD we use at the Plant Med, there's the full spectrum extract. That's like everything in the plant, including all the cannabinoids, terpenes, and even with THC. Then there's the broad plant extract, which is the full plant extract with the THC deliberately taken out. So still got the entourage effect, but no THC. Then we have CBD isolates, all those three in oils. Now we have a new one, which is nano emulsion, which is water soluble, but very expensive, so not often used. Yeah. So going into the cases, level 3 ASD is our first case, 15-year-old male seen by a former Plant Med doctor who's left the building. So this kid came to me. Diagnosis of non-verbal ASD level 3 at age 6. High anxiety, physically aggressive, any changes in routine very poorly tolerated. Meds tried risperidone, was completely ineffective. So the previous doctor started this fellow on a small dose of a category 2, almost a category 3 really, 15 milligrams of CBD and 10 milligrams of THC, titrated up like that. 5 weeks and 3 months, going well, aggression controlled without being overly sedated, sleeping well, doing pretty good. Then at 4 months, it came to me, and I made a note of less aggression, working on reducing behaviours, e.g. pulling mum's hair to get attention. And the parents are wanting to finally get away for a holiday and put them in respite care for a little, but they require a letter saying that the medical cannabis is aimed at reducing any aggressive tendency and to reduce anxiety and depression and odd behaviours. So that was at 4 months. At 11 months, he stopped the nighttime risperidone. It would make him sleep better. His behaviour was worse the next day, pulling hair, etc. Also hungry all the time, putting on weight. Then at 17 months, the NDIS did not like my letter mentioning reduced aggression. They said, suggesting the treatment could be classified as chemical restraint. So I had to write another letter saying that actually these behaviors are caused through anxiety, and so the medical cannabis works through reducing anxiety rather than a chemical restraint of aggression. And also explained that that we're going to have to change this child over to a category 1 because of the new rules from the TGA. So then I decided to start him on one of the new category 1 full spectrum CBD and MCT oil, a very potent drop, and then titrate the old one out. All right, and so happy ending. 18 months at the doctor's script call, mum reported the titration worked perfectly and the parents are all set to take a holiday. Calm and happy, no aggressive behaviour, improved communication, using favourite words more, e.g. dad or pet's dog named Della. NDIS were happy with my letter, and so the lesson learnt here, 100 milligrams of CBD and a trace of THC worked better in this case than 18 milligrams of CBD and 12 milligrams of THC. Interesting. So going on to case 2, another level 3 ASD seen by fellow Plant Med doctor and director of Plant Med. And so this is a little girl, 11-year-old girl, who was like very serious ASD, non-verbal, grunting, developmental delay, OCD, insomnia, chronic severe anxiety. So you can see down there on the right-hand side, started on a CBD 25 milligram THC 2 milligram. That one titrated first, then added a CBD 100 milligram full plant extract. So 12th of May, the titration started. 1 month, really, really well, doing some really, seeing some really good changes. And so titrating up, nurse handed at 5 months at the doctor's script call, all going well, to add an isolate 100 milligram per mil, and the dose would be 90 milligrams of CBD daily and 4 milligrams of THC. Then at 9 months, the note from the doctor, very volatile initially, non-verbal, lots of anger, settled now, CBD 2 types at the same time, and so continued on that dose. Then at 1 year, 9 months, came to me, new doctor. Now she's 13 years old, has been stable on the medical cannabis, but OCD behaviors are more of a problem. And the pediatrician started some sertraline, which seems to have improved things, but she still has significant OCD and ADHD. Restarted on Ritalin, struggling a bit with the Ritalin, but going to school okay. And then, because of the TGA enforced change of regimen, she was seen on the 22nd of August, had to be changed off the THC containing drop. And so started her on the brand new high terpene 200 milligram per mil with minimal THC and hemp oil, and as a replacement for the old products that we were no longer able to get. 2 weeks later, an email from the mum: "Can I please organise an appointment with Dr. Tay as soon as possible? Her oil was changed by one of your other docs," yours truly, "and it's not going well. She's super angry, frustrated that it's not helping, very aggressive, and now refusing, which becomes an hour-long battle to get her to take it. After 3 years of such a good response, this is very upsetting." So I had an appointment with her that same day and switched her back to the old category 1, but raised that from 20 milligrams twice a day to 50 milligrams twice a day. And awaiting reports. Lesson learned, it's not all plain sailing. Actually, in fact, a few weeks later, I actually saw the mum as a patient who turned also out to have ASD and ADHD. And we got along very well, and the kid is doing very much better. And so everybody's happy there as well, even though this is my most difficult, worst outcome in all these 10 cases. So case 3, this is a 6-year-old male seen with mum on Zoom. And this little guy was born as with cesarean section and had a asymmetric palate, so I was unable to get sucking reflex going, had all sorts of problems initially, very poor weight gain, a lot of diarrhea and digestion issues after the first MMR shot, very sensitive to grains and lectins. And then from 3.5 years, he developed serious ODD, oppositional defiant disorder. Total non-compliance with requests or commands. For example, won't put shoes on, even if it means he won't be going to the pool. And now the teachers are saying ADHD. Mum says he's a lot like his father, who gives no apologies for anything. Anyway, an extremely stressed kid, and mum extremely stressed also. Mum feels the ODD is all due to severe anxiety, and sleep is okay, but he has anxiety about going to bed. Very hyperactive, good appetite, tries to get at the stuff that upsets his behavior. Irritable bowel syndrome, gut pain, diarrhea coincide with the oppositional behavior, which is an important note. He's on a bunch of different supplements there, but not really doing much better. So I started him on a category 1 isolate, CBD 100 at about 30 milligrams twice a day for, and then if no problem, go up to 50 milligrams twice a day. And at the 4-week script, mum felt that it just started to strike a change in the last week, and but he'd also had brain math at a cognitive clinic, which confirmed ADHD and ASD. They want him to start on Ritalin, and mum very supportive of this, as she is on dexamethasone for her own ADHD. So another parent that's that turns out to have her own diagnosis. So then at this point, I switched him to our new category 1 whole plant CBD 200 milligram per mil. And so we can push the dose up without breaking the bank. Yeah. Mum got in touch with me saying that she had a real battle with the school and wanted a letter requesting, because they would actually take give him the Ritalin, okay? Her paragraph here is worth reading. "I want them to give him a dose with his Ritalin at lunchtime, but they're being funny about CBD. Not funny at all about Ritalin, mind you. Happy to throw that down his throat, but they aren't accepting the bottle with script label, the titration instructions, nor the TGA approval document. They want a letter specifically from you stipulating, etc." Anyway, so that was no problem. And then at the 3 months, we got a report of amazing with the help of Ritalin, but even before that, he was improving. But mum had to really fight to get the school nurse to give the medical cannabis, had to write a 6-page email. Anxiety improved out of sight, sleep is better, ODD is reduced, irritable bowel syndrome has subsided, though it's still a battle for mum to educate teachers, etc. Actually, on this consultation, mum was in the car at that moment, waiting at the school to ambush the responsible teachers for allowing him to eat the wrong food. So In summary, another happy ending, but perhaps not for the teachers. Case 4 is not ASD, but Down syndrome regression disorder, which is sort of a diagnosis I'd never heard of before this particular case. There's a 19-year-old female seen in the clinic with mum and dad, previously high-functioning Down syndrome, but then in 2019 developed severe anxiety and depression. Parents obtained CBD from an illicit source, and she was more sociable on this. But then she was seen by a specialist pediatric neurologist who diagnosed Down syndrome regression disorder with high anxiety and catatonia. Catatonia is where she gets so anxious she just seizes up and nobody can get through to her. She's just sitting there, and even if you hit her over the head, she won't respond to anything. So she was started on low dose, then high dose lorazepam, 10 milligrams twice a day, and then on 4 times a day, then on lorazepam antipsychotic with maybe a 10 to 15% improvement. And so before I saw her, she was getting THCA 9 drops daily, derived from Cannabis ruderalis, CBD unknown potency, lorazepam 10 milligrams QID 4 times a day. That's like a dose that would knock over an elephant, let alone an adult human. And but it seems to be used specifically for this regression disorder. Then lorazepam antipsychotic, and pediatric neurologists intending to get her into a trial using IV immunoglobulin, which is this particular disorder, Down syndrome regression disorder, is theorized to be an autoimmune disease affecting the cerebrum. Yeah. And anyway, the response to the previous medications was not that good. You know, a lot of anxiety, sleeping pretty good, 9-10 hours, but the parents want to improve her quality of life. She's lost all of her skills, wearing nappies, and a little bit improved since starting a small amount of CBD, but still not that good. So on the 12th of April, she was started on a new full spectrum CBD 250 milligram per mil in hemp oil. It's a pump spray bottle, which we had a few problems with because we could never figure out the dose. But the 25 milligram dose per pump that we thought it was actually turned out to be 36 milligrams. So basically she got quite a good overdose of that immediately. And she was better for about 6 weeks, then started developing irritability and anger. And so parents tried to take her off it, and then put her back on it, and it was pretty predictable effect, increased irritability. So they stopped it. And then at 3 months, I offered them our good old tried and true CBD 100 milligram with THC 3 milligram, used in many ASD kids at the Plant Med. And at 4 months, 1 month later, the new oil is so much better, more sociable, happy, and everybody noticed a big difference. Less waves of catatonia, and each lasting only 5 or 10 minutes, and also less tics and muscle twitches. They've continued a little dose of lorazepam, and so we increased the new CBD dose to 50 milligrams twice a day. Then at almost 6 months, patient very good, new CBD making a massive difference. Continues on low dose lorazepam and reduced dose of lorazepam. She's doing so much better. And then at 13 months, we decided to try another one. This is a broad spectrum CBD, an olive oil. And so with that one, same dose, 50 milligrams twice a day with 0 THC. Actually, mum preferred the new product, more calming, less anxiety, noticing anxiety flares in the evening. And so I told them they can increase the dose to 3 times daily. At 1 year and 4 months, she had her first dose of this immunoglobulin therapy, based on the theory that catatonia is an autoimmune encephalitis, part of a trial in which 80% have responded and 50% come off with prolonged improvement. This is the first case that was approved in Queensland. First of all, she needed no pre-meds except the CBD, which was amazing. And then by day 2, she's getting some really good days. 45-minute session with occupational therapy, improved activity with jigsaw, seemed to have been a big improvement. And so on this base, they have approval for the next 3 months. Discussion on this one is important. Some CBD oils can cause agitation and increased energy or mind activation, and which is the one you want to take in the morning, right? And so this 250 milligram hemp oil was also found to increase insomnia in some patients. So the lesson there is that we need to know more about the derivation of the oils. Are they from an indica variety or a sativa variety? What are their terpene levels and profiles? This information is actually now being increasingly included by manufacturers with their products. So anyway, case 5, we'll just quickly go through this one because it was another 24-year-old Down syndrome regression disorder. It's a very similar case, but 24 years old, and also had serious cardiac issues, open heart surgery at 3 months, so not eligible for the immunoglobulin. The catatonia developed over the last couple of years, freezing episodes, shut down, unable to do anything. She gets catatonia 2 days before her period, and it lasts about 5 days. She has 5 days of catatonia until the period stops, and then she's okay again. Previous meds, lorazepam, Florinef, like some supplements, lactulose for constipation. So we gave her the same oil that works so well for the other Down syndrome regression disorder. Minor improvement at 4 weeks, and then the sleep was a problem. So I decided to titrate a C12T12, like they had 12 milligrams per mil of CBD and 12 milligrams of THC. But after the first dose, we got a letter from the mum saying within 2 hours we had a behavior change unlike what we'd seen with her to date. Crying, irrational, glassy-eyed, tried for 2 nights with the same reaction. Sleep pattern was also worse. I had to sleep with her, so we discontinued. On review, I now realise that this was a sativa hybrid oil, so I would never use that one again, and probably would have had a much better dose if I'd used the Indica 1015 oil that we've got now, which I used on another case coming up. So another set of happy parents, and handed over to the nurses at 3 months, and they've been seen since and very happy. Okay, now case 6. This is ASD level 3, once again, a 10-year-old male in Western Australia, Perth. Seen with mum on Zoom, youngest of 7 children. 2 other sisters have it, but he's the most disabled. Sisters are both verbal and go to school. He's non-verbal with several single words and occasional echolalia, where echo is what his mum says to him. Quite hyperactive and aggressive at times. Born by a cesarean again, and mum said he's a sensory seeker. Google that. A child that has a high neurological threshold or a very big sensory bucket that needs to be filled with sensory input. Age 2, the ASD cut in, a lot of ritualistic and obsessive behaviors, completely non-verbal. Also diagnosed with OCD, constant tics, vocal grunts and motor tics, and a lot of sensory seeking behaviors. And when he gets frustrated, he's now increased head butting and banging legs or head on the ground to get attention. So diagnosed with ADHD at one point, tried on Strattera, that was unsuccessful. Now developed these strange behaviors of touching the food on the table and the chair, etc., before he eats it, or has to touch all the walls and surfaces before he comes in the door when he gets home. And appetite pretty good, becomes very screechy, high-pitched screams if he has glutinous products like Domino's pizza. Sleep terrible, but comes in waves. They'd been tried on a whole bunch of different medications, none of them successful. And so he was started on that same category 2 full extract product that worked on so well for the 2 Down syndrome cases. CBD 100 milligrams per mil, 30 milligrams twice a day, with a wee little bit of THC in there, category 2 product. 3 weeks, the first hurdle was getting it into him, but eventually he just accepted it into his cheek pocket, and so it was all go. And the first few days he got giggly, he seemed a bit more hyped up. And Dad says he's sundowning, started squealing a lot more. And then, but on the other hand, he developed a lot more words already. 5-week doctor appointment. The first 2 weeks on the CBD noticed a big reduction in the tics and head butting, but then he started getting hyper and wound up. But he's also been using a lot more language, and even started saying his own name for the first time. He says, "Bye, Zach," not his real name. Multiple new words emerging, even strings of words for the very first time, e.g. to his sister, good night, Evie, see you soon. An amazing improvement in his vocabulary and his cognition, by the look of it. 3 months Dr. Caller was a bit disappointing because the 30 milligram dose, he eventually became more hyper and agitated, and also getting first signs of puberty, and so starting to get a lot more meltdowns, then one a week, then twice a week, now multiple times a week. He'd also had an appointment with his regular behavioral pediatrician, who felt pretty sure that his main problem is anxiety, but he gave a script for sertraline and fluoxetine for if the CBD didn't work. So in discussion with Mum, we decided to try the new category 1 terpene-rich full extract CBD 200 oil and MCT. That's a little bit of about 1 to 1.9 THC. Started at CBD 50 milligrams twice a day. And about a couple of weeks later, I got an email from Mum, praise the Lord. It says, hi, Dr. Van Dorp. I just wanted to give you an update. So far, his response has been really good. While still prone to the occasional meltdown, he seems less anxious overall, mostly a happy boy. His school uses a communication book to inform us of how his school day has been. We're seeing lots of Zach had a wonderful day. Zach was amazing today, and Zach was very engaged with school activities today. He's seen a big increase in echolalia and is trying to repeat most words that I say to him. He even engaged in some pretend play, which he doesn't usually do, and read a book about fish to some fish friends. You can see him there reading his book about fish to his fish friends. His tics have also noticeably lessened. I'm feeling quite positive about how he's going on this new oil. So there we go. That was another success after a bit of a trial, which is a bit unusual because in the previous Down syndrome kid, we'd tried that first. I tried a sort of an uplifting oil first, a 250 milligram one, and then had to go to the C100. And on this one, we tried the C100 first, didn't work well enough. So when we went to the 200, it was great. So this case 7 is not ASD, but I've included it out of interest. It's another one seen by a fellow plant med doctor and director. And the brain injury due to snake bite, the most venomous snake on the earth, I found when I Googled it. And I think he's the only pediatric taipan bite that has ever survived. And so Dad had been worked by, when he saw plant med in 2021, Dad had already been working with illicit cannabinoids and had managed to reduce the Topamax and was 8 months free of seizures. So he was titrated on 2 separate CBD oils, first an isolate, 100 milligram a mil, and then a full extract, CBD 100 milligram in olive oil, also up to 100 milligrams twice daily. So he was getting 400 milligrams of CBD a day and 7 milligrams of THC. Then 1 year and 4 months, he was seizure-free for 8 months and almost off the topiramate. Dad was also experimenting with hyperbaric oxygen therapy. Then in July 2023, almost 2 years, appointment made with me as the TGA approval is running out, needs reapproval. So I found it very interesting that Dad had used this hyperbaric chamber, and he's titrated both of the CBD oils down from 400 milligrams CBD daily down to 50 milligrams daily total, and seizure-free for a whole year and a half. And so then some details about the chamber. It was a Chinese-made chamber that goes up to 1.5 atmospheres, and he noticed if he went in it too long, it increased seizures. Found a sweet spot that arrested all seizures. There was 1.35 to 1.5 atmospheres with 8 liters of oxygen via mask, 45-minute sessions, 5 days in a week. And if you went over the 1 hour mark, noticed an uptick of the nocturnal seizures. But very amazing. And I've since found out they've actually started using this hyperbaric therapy in newborns as well, that have had like ischemic events, like blue babies that would often end up with brain damage and autistic spectrum disorder and cerebral palsy and so on. And they find, looking at with the MRI, the hyperbaric oxygen fixes these areas of the brain very quickly. And very interesting. Yeah. Still seizure free, but his own doctor had to do a request to his father to get the pediatrician to consent to keep him on the same meds to get the category 2 CBD back into him, and which is as of a few days ago, this is all done. So he's doing pretty good. Case 8 is another case of ASD level 3, but also has ADHD and his trisomy 14, which is a genetic abnormality that gives a kid. We have a very large 12-year-old Vietnamese kid with a Down syndrome hydrocephalus look with flat finger and toenails. Goes to a special school. He's very physical getting into adolescent phase, very exhausting and very hands-on, needs like help with dressing and hygiene, difficulty regulating emotions. He can lash out with his toys, and he prefers hard toys like digital phones and tablets. So over the years, damaged a lot of equipment. A big challenge, this boy, 58 kilos, big boy for 12 years old. So he's got sleep disturbance, ADHD, and aggression. And many meds they tried to slow his hyperactivity, just made him more aggressive. And lives with the parents, sleeps in the same room. This is a Vietnamese cultural practice. So he started on a category 2 full extract CBD 100 at 50 milligrams of CBD twice daily. Nothing much noticed at 1 month and 2 months. So I started another product, and this one is the organic MCT oil product with 10 milligrams of THC for every 15 milligrams of CBD. And so that's the little titration I sent them to stick to. And we were still able to do that at that point because the TGA hadn't started clamping down. And so by 6th July, 3-month doctor review, he actually had got the medicine but hadn't started it yet. So as the sister hadn't actually communicated it well to the parents. So we came up with a plan, organised with the sister, to switch to a new reduced price full extract C200 product so we can get that dose of CBD up as high as we like and without too much money involved. And the sister would translate the titration document to Chinese and put it on the fridge so mum can start titrating the new product. 5 months, sleep is 20 to 30% better on the new product, and he's not needing risperidone every night. And so we decided to keep it on 100 milligrams twice a day of the CBD. And we can actually titrate things up, and things seem to go in the right direction. So like we're hoping for a win on that one. Case number 9, ASD level 1 to 2. This is a 13-year-old male seen with mum on Zoom. Normal milestones, but took a while to start walking, 15 months. First clue that he had autism was when he tried to hit mum's friend with a lightsaber. And then his kindergarten teacher said she'd never met such a stubborn child. She could find no way to make him do something if he didn't want to do it. Mum smiled and said, "Welcome to my world." Very intelligent, could speak in 9-word sentences before 2-year-old, genius level, solves all the Rubik cubes, wins competitions, extraordinary memory, but has a hard time writing what the teachers want him to write in exams. He appears to be perhaps a developing Rain Man, Dustin Hoffman type character. Pediatrician saw him at age 8 or 9, confirmed some criteria of ASD, and then they had 3 or 4 years of counselling, speech therapy, etc. But with some improvement. But mum felt that he's now in a holding pattern. Now he's starting to get a lot of meltdowns. Very fixed mindset. And on his meltdowns, when he gets stressed, he starts hitting himself, scratching himself, punching himself in the face. And doesn't happen at home, but at school. And also happens sometimes when he goes to sport. So he tried to go to karate, but too many meltdowns and started punching himself instead of the other fella. His comment when mum told him we'd arranged a consult with a cannabis doctor, he says he didn't want to be taken to a witch doctor and given marijuana. However, he was very polite and civil when introduced. He likes following the rules. So, he goes to bed at 8:30 p.m. and he wakes up at 4:30, but because the rule is he can't get up till 5 a.m., he stays there till 5 a.m. He likes following the rules. And that was one of the big issues at school when other kids wouldn't follow the rules. So we started on a broad spectrum CBD 100, our olive oil one with 0 THC. And at the 3-week courtesy call, not much difference. Had a good comment from the care coordinator here, but not really enough time to go through that, except the bottom paragraph there. I had a look at the clinical trials in Melbourne on CBD and ASD kids to see what they're dosing. Notice they're taking over 500 milligrams per day with great results. This, of course, would not be financially viable at that dose. But anyway, it made me, when I saw them at the 5-week script call, increase the dose to 70 milligrams in the morning, 30 milligrams at night, and told mum to go up further because we're going to go up to as far as 500 milligrams if necessary. And so then at the 3-month review, mum reports it took 6 weeks to work out the dose. And then when he went to 100 milligrams in the morning, his behavior changed dramatically. Had no meltdowns since then at school, and very relaxed, comfortable, no longer anxious. Everyone has noticed and commented. He gets through the school day with 0 meltdowns. Sometimes gets a bit frustrated at his tennis lessons, late afternoon, so the dose is wearing off. I told her that she could give another 0.3 mils before the tennis lessons if she wanted. But he's been handed over to the nurses with a dose of 100 milligrams CBD in the morning, and that's it. Does the trick. And 14th of September, just a week or two ago, still doing good, no meltdowns, really, really good. Mum and patient both happy with the results. And so our final case, number 10, is an ASD level 2, perhaps another autistic savant, very highly intelligent, but also very highly anxious. He's got good communication abilities, but he's very anxious, and so he's not going to school at the moment, not going to any classes, just staying at home and taking out his anger on his mum. So he's a strong ADHD component. He was started on Concerta at age 9, which really helped, but then he got very skinny, underweight, down to 3rd centile. So off the Concerta since December 2022, he's put on 10 kilos and 10 centimeters going through puberty on... used to have food aversions, now eats everything. He's much happier off the stimulants, but unable to sit still or hold conversations or do schoolwork. Hence, they'd put him back on the Concerta for the last week, but getting angry and more depressed on it. So that was the situation. Sleep disturbance. He had melatonin since age 4. Without it, he would never sleep. Energy is good, but and really hyperactive with the ADHD. And so his meds, Concerta, fluvoxamine for anxiety, risperidone in the afternoon for anger, melatonin, all of the above not working now. So he was supplied with a category 2 full spectrum CBD 100 milligram in olive oil and dose 40 milligrams twice a day. At 3 weeks, another very positive courtesy call report from the beautiful Krista, sleeping so much better. Reports from mum, much calmer, much happier, has not spoken about suicide in weeks. It's all stopped. His little brother, with whom he'd been so angry, are best friends again. So steady progress, a low dose of CBD 40 milligrams twice a day. And then at the 3-month review, definite improvement, but still room for more improvement. So I wanted to hand him over to the nurse with telling them to increase the dose of CBD in the morning to cover the afternoon and evening explosivity. And then the first nurse script, since we had 2 nurses on leave, was done by my fellow plant med doctor and boss and director. And he made the notes that mum and patient very happy off all the pharmaceuticals, functioning so much better in all respects, 3 months medical cannabis supplied. So a few concluding comments. 10 out of 10, I think, is a pretty good score for getting at least some improvement in all of these kids, though some did a lot better than others. It seemed that in each case, the titration level at which the CBD worked well was unique. Some required very high dose of CBD to improve symptoms, but when the correct level was reached, the switch into good balance and function was very quick, almost immediate. Due to the financial support is required for these children, I think. I mean, it would be very, very good for society if we could get all of these kids onto the right CBD and calm them down so they can go to get their education, less support from community support services. But due to the high cost at the moment, it can't be used by most of these lower income families out there. So another point is that THC must be used with care. We saw a couple of cases where it didn't do any harm, but had some quite negative effects on the kids. But some of them do require a bit of THC, and I'm very glad that I managed to get in before the TGA clamped down with the big, strong Vietnamese kid who loves to smash iPhones and iPads. However, it does need to be used carefully and with knowledge of its actions and side effects. And I support the TGA approach of authorization by expert medical practitioners, but these should be, I think, specialist cannabinoid clinicians, not other specialties that know nothing about medical cannabis. Some more comments. What are the causes of the skyrocketing pandemic? Scientific studies must be done on finding out the causes or factors of this global pandemic we can see now. This seems to be rocketing out of control in many, if not all, nations around the world. But there are some groups, such as the Amish people in Pennsylvania, that have zero incidence of ASD. So this group in particular is worth studying, looking at closely to see what they're doing right. Factors we can improve in general would be 1, trying to have a clean organic diet. 2, turning the Wi-Fi off at night to reduce the electromagnetic frequency radiation. Exercise is important to get a good endorphin and happiness level going. And sunshine, very important, not only for vitamin D and healthy bones and immunity, but also for reprogramming the body clock to help with insomnia, as in our big Vietnamese kid again. So the final comments, a gateway herb, medicine superb. This has been a massive learning curve for me over the last 2 years, which is still happening as I begin to understand the role of terpenes and other cannabinoid profiles of the different products. A lot of the experience has come from trying the different products and seeing the results. And it's reassuring that in 2 years, I don't think I've damaged any patients. At least nobody has told me so. So I hope my experience in trying different products with different patients will be helpful for other practitioners working with this wonderful medicine, I have to say. It's not a gateway drug. My final comment, I got to say, this is not a gateway drug leading to other drugs, as they used to say in the bad old days, but in fact, it's a gateway herb, medicine superb, leading we medical practitioners back into the wonderful ancient realm of plant medicine. So I'll leave it there. Have a good day, everybody. For a moment, I thought I hadn't recorded all that, but it does seem like it's a done deal. And so everybody's happy. Patients, staff, doctor.